First of all, it's a pleasure to be here to be able to visit with you about some of the planning that we've had going on and some of the planning that we have for the future. Not so much looking back at what we've done as far as technology goes, but doing our planning from here going forward. And so I appreciate the opportunity, Kelly, Dave Preisler, the Minnesota Pork Board, to come and talk to you about this, because I really want to get, I'm hopeful that I can get reaction, feedback, information. I'm going around to a lot of state association meetings. We've had a lot of talks about planning for the future and how this thing can work. And I'm very interested in your thoughts on where we should go and how we should go forward. As we've approached PED from May of 2013, from the time that we had the conference call with USDA and the announcement that we have PED in the country, the American Association of Swine Veterinarians, the National Pork Producers Council, and the National Pork Board have worked hand in glove. I can't stress enough the cooperation, the coordination, and the collaboration that we've had with the three organizations working on this issue. And we really do look at it as a type of three legs of the stool in order to hold this thing up. NPPC is working on a process to develop a response plan, and how that will work for future diseases as we look at other things that can come into the country. So we have an agreed upon response plan ahead of time, so we know we've got coordinated state, federal, industry response. That was one of the things that was a primary lesson out of PED, in a need for a better coordinated response, not just from industry, but from everybody. AASV, the swine veterinarians, are taking a look at the diseases around the world and giving us a list of those diseases, and I'll show you some about the swine pathogen matrix and how that's going to work. But we've got to have an assessment of our risks. If we're going to be prepared for the next infection, then we've got to have an assessment of the risks and the risks that we have for other things coming into the country. And finally, the Pork Board has been working on information management and the systems by which we can share information. We can put checkoff to work in being better prepared through our mandate of research and education. And those are the three legs of the stools. I'm going to talk a little bit about each in a little bit more detail about each one of those. The National Pork Producers Council had a resolution last year calling for the organizations, NPPC, but the organizations to work on this coordinated strategy. And it's government industry organization coordinated strategy. So NPPC put together a working group in which all of these people got together, getting them all together and talking about the PED response, learning the lessons from the PED response and how we can apply that as we go forward. Out of that planning process came the concept of forming a U.S. Swine Health Board. That U.S. Swine Health Board is modeled after our success with the pseudorabies eradication program. During that eradication program, we had a pseudorabies control board that periodically got together and looked at the state statuses, looked at program standards, did this state, federal, industry cooperative effort. We didn't have any legislative or any regulatory authority, but it was an advisory group. But it worked very well because we had the states, we had the federal government, and we had industry sitting down at the table at the same time talking about pseudorabies and talking about eradication and coordinating efforts and communication. U.S. Swine Health Board is modeled after that because of that success. And the ability to put together a swine health board that can put the state, federal, and industry folks together at the same table for a response to a new infection is the whole idea here. We're putting together a list of actions that are a priori or agreed upon ahead of time that could be taken depending on the stage of disease when we find it in the country, and that U.S. Swine Health Board can then use producer input, and that's a real key to this, because it provides producer input into what could eventually turn out to be a regulatory effort like we've seen with PED, where we started out with simply a new disease in the country, but turned into a regulatory program with ID and premises ID on behalf of the federal government. So U.S. Swine Health Board gives us that opportunity to coordinate response. The Swine Pathogen Matrix and the AASV effort goes back to a need to do some risk assessment and some communication about things that are going on. We got PED in May, we identified it in May of 2013. In March of 2012, the American Association of Swine Veterinarian and Swine Health Committee was convened during their annual convention. And we sat at the table and heard a report about diseases around the country. And one of the diseases that we heard about during that meeting in March of 2012 was PED. And the veterinarian said, well, there's PED circulating around in Canada. It's a very bad disease. Here's what happens, and here's how it works, and here's what's going on. And we adjourned and said, it sure is a good thing we don't have that. And back in 2012. We didn't do anything about it. And that's another lesson learned, that we've got to do something about those risks and those opportunities. So the AASV opportunity here is to take a look at the viruses that are circulating around the country and to assess how prepared we are to address those should they get here, diagnostically and otherwise as far as information. A PCR, virus isolation, the blood test ELISA, can we use oral fluids? Is there an effective vaccine? If you take the list of viruses on the left side and put the list of needs along the top, we can fill in those cells with a yes or no answer. There's 40-some viruses that are going to be on that left side. This is just an example. There are 40-some viruses that are going to be on that left side. There's a lot of holes there, and there's a lot of work that has to be done, even with the yeses, to validate that it's actually a usable product. So that's going to help our preparedness as well. We've got to be better prepared to respond once a virus gets here. The pork board efforts in managing, boy, you go back and you look, and I've talked already a little bit about lessons learned, but you go back and from May of 2013, one of the messages that we all talked about as we went through this process, all three organizations, was we need to remember these things that are going on because there are lessons we have to learn from this for next time. I will tell you that one of the main lessons, and the reason for all this preparedness, you haven't heard me talk about preventing something from coming in. It's all been response. I'd love to prevent it from coming in, but one of the main lessons is that you can't expect that we're going to be able to prevent introduction of these viruses. I'm sorry, but it's a fact. And I'd love to prevent it, but when you look at all of the products that are coming in the country, all of the inspections that are happening, and all of the opportunities for viruses to gain entry into our production systems, the likelihood of being able to prevent something like PED from coming in is so extremely small. We have to be better prepared to respond to it. If we don't learn that lesson, then it'll be shame on us. We can't expect USDA alone to help us. We've got to have industry responsibility, and we've got to have responsibility on our own to do things that USDA either can do, but do too slowly, or really just don't have the regulatory authority to do. One of the things we heard on the call in May of 2013 was, we're not sure we have authority to act. USDA told us, we're not sure we have authority to act on this, but we will help you in any way we can. That was very welcome. That was fine. But we have to take industry responsibility for these diseases, because remember, these are production diseases. We're not talking about foot and mouth disease. We're not talking about classical swine fever. We're not talking about African swine fever. These are production diseases. We got PRRS in the late 80s, early 90s. We got circovirus in the late 90s, early 2000s. Now we got PED. And those are our responsibilities. We have a responsibility in that as well. And that's what we're talking about with the industry stepping up and taking some responsibility. Finally, that better state-federal industry coordination, and that harkens back to the formation of the Swine Health Board. So one of the things, as we summarize lessons learned, there are big threats. A lot of those threats are that originate in Southeast Asia. We've got to be better prepared for introduction from those threats. Diagnostic capabilities, awareness of how to respond. We've got to, through the examples, for example, of the Swine Health Monitoring Project that Dr. Becton talked about, and sharing of information with site status and disease status, we've got to be better prepared in sharing information in a manner that is secure and can happen between producers and among producers to help inform production decisions. That's where the Swine Health Information Center comes in. The Swine Health Information Center is a checkoff-funded project that will be separate from the checkoff itself. And I'm going to go through a little bit about how that's going to work and some of the things that it's supposed to do as a project. But the mission statement for this: protect and enhance, targeted research investments, collection and analysis of health data, and global disease monitoring. Those three things. And I'll update this a bit. It's not so much collection of health data as it is of monitoring of health data and analysis. But that's the mission of the center. This center is going to be a virtual center. The objective is to keep the overhead as very low as possible and enable all of the money that's going into this to go toward those activities rather than having high overhead. So it's a virtual center because it's going to be a coordinative and informational center rather than an office in a building someplace. It'll be a separate board of directors because it'll be its own 501c3, separate from Pork Board, separate from NPPC, separate from AASV, a fourth leg of the stool, if you will. We're going to be lean and mean with task forces but provide the necessary oversight for what needs to happen. And importantly, this has a 5-year lifespan. This isn't an ongoing thing. It has a 5-year lifespan. We're going to have a start, we're going to have an end. If between that start and end, it can demonstrate value and demonstrate ongoing value, then there's going to be opportunities to continue funding. It's a $15 million project over 5 years. The $15 million is coming from supplemental money from the Pork Board. This is money that has come in from 2014, 2015 because of the increased checkoff income coming from the PED situation. This is outside the normal Pork Board budget. It's not going to affect the marketing budget. It's not going to affect international marketing. It's not going to affect program money. It's not going to affect research or education. This is extra, and the objective here is from the Pork Board, is to provide the opportunity for an investment in the future of the industry. Use this money that is available at this time to provide an opportunity for further investment. Scope of work includes this Swine Disease Matrix project and the research that needs to happen in there. About $7 million of that 15 is earmarked for filling in that matrix so we're better prepared diagnostically for things that are going to come in. There's going to be data management and monitoring of trends and data analysis. It's epidemiological work that is really centered around helping the Swine Health Monitoring Project do a better job, enhance that, do a better job, make that data available for more producers, also make it more analytical to provide information to producers that can help affect the health of the pigs on the farm. This isn't theoretical. This is to affect the health of the pigs on the farm. Along with that, PADRAP, the Production Animal Disease Risk Assessment Program, is a program at Iowa State that needs some enhancement and some help to make it more effective. It's a risk assessment for introduction of pathogens into the herd. This can help with secure pork supply and the things that we're doing to try to prepare for introduction of very bad diseases, foot and mouth, classical swine fever, those types of things, because it's a data management issue and it also can support trade. Global swine health information and issues identification is going to be the third key thing of the Swine Health Information Center, a global network to help inform that AASV matrix project so we can do a better job of predicting what should be on that list, prioritizing that list, reprioritizing that list every year or every 6 months or every month, whatever it takes to make sure that we've got the highest priority viruses prepared for within our industry here. And the outcome of this whole thing is going to be the improvement of biosecurity and biocontainment and health of the U.S. swine health herd. So the deliverables of this thing, of this center, is going to be the diagnostic capabilities. It's going to be managing that matrix, to update that matrix with the international network and information coming from about international diseases. It's going to be epidemiological analysis that is going to be available for your information to help you better manage the health on your pigs, know the risks of moving pigs around the country. We've got pigs on the road every day, and everybody's got pigs moving. We need to better understand the risks, the disease risks associated with that, managing that information, and making that information available to producers, future projects, secure pork supply, and international trade. This in itself is not a disease response plan. That goes back to the U.S. Swine Health Board. This is not a U.S. Response plan, but what it is, it's a tool to help response. It's not FAD surveillance. It's not anything USDA is doing right now. It's not foot and mouth disease. It's not classical swine fever. It's not the things that they're doing right now. It's added on to the things that USDA, NPPC, Pork Board, and AASV is doing. And this is going to be a tool to help us better respond to diseases in the future. That's the summary of this. That's where we're going. Those three legs of AASV with the disease matrix, NPPC with the planning process, and Pork Board with the Swine Health Information Center, and adding that fourth leg is going to add to the stabilization and add to the stability of the U.S. swine health herd. And that's the whole issue about this Pork Board investment in the future of the health of our animals and the health of your animals and helping you manage that.